What causes prostate cancer? Unfortunately, the answer to this is, at this stage, we really don't know all the answers. We do know that in patients diagnosed at a young age, that a lot of this cancer is due to genetic causes. What do I mean by genetic causes? Well, if you have a strong family history, it often tends to run in families in the identical way. For example, if your father developed prostate cancer at 55, you might have an increased risk of developing prostate cancer also at a young age. So what is the increased risk? If you have one first-degree relative, such as a brother or a father, it doubles your risk. If you have two first-degree relatives, it 5 times your risk. We also need to realise that breast cancer and prostate cancer are quite tightly linked. And in families with a lot of breast cancer, there's often, at the same time, many men with prostate cancer. So, if you've got a father, a brother with prostate cancer, or a lot of breast cancer in the family, you need to start thinking whether you might be at increased risk of developing prostate cancer. Can we do any genetic testing? Well, at this stage, there are very few genes known. There are 1 or 2 called BRCA, B-R-A-C-A, 1 and 2, and ELAC, but they're fairly rare, but if you do have them, it's useful to know about it. So if you do have a very strong family history, it's even worth seeing a genetic counsellor for information about this. Prostate cancer affects 1 in every 6 men in Australia in their lifetime. 2 to 3% of all men will die of prostate cancer, and clearly it's a major health issue. Indeed, it's the most common cancer in men.
According to a recent review, the most notable development in the epidemic of prostate enlargement and lower urinary tract symptoms is the recognition that modifiable lifestyle factors substantially influence the natural history of these conditions. These are the factors associated with increased risk: obesity, diabetes, meat, and fat. And some associated with decreased risk: exercise, moderate alcohol consumption, and vegetables. Which vegetables? Garlic and onions appear to help. I like how they call them onion users. Cooked vegetables appear to work better than raw, so maybe it's the carotenoids. And legumes were also found protective: peas, beans, and lentils. And flax seeds appear so powerful that they may be used to both prevent and treat the condition. A randomized, double-blind, placebo-controlled clinical trial that found that flax phytonutrients not only alleviate BPH symptoms, but their efficacy appeared comparable to the drugs we spend $1 billion on without the side effects. Flax seeds also work against prostate cancer. These researchers had men who were about to get their prostates removed eat 3 tablespoons of flax seeds a day for the few weeks before surgery. They were skeptical that they would observe any differences in tumor biology between the flaxseed fortified diet treated groups patients and the controls with such a short-term dietary intervention, but they found significantly lower cancer proliferation rates and significantly higher rates of apoptotic cancer cell death, cancer cell suicide I've talked about. Thus, these findings suggest that a flaxseed-supplemented low-fat diet may have an effect on prostate cancer biology. Just a few things have been found associated with a significantly increased risk for the disease: refined grains like white bread, also eggs, and poultry, which appeared even worse than red meat or desserts. Although these data are observational, more research is necessary. There's little, if any, downside to promotion of healthy lifestyle interventions: weight loss, exercise, decreasing meat and fat intakes, and increasing vegetable intake among those with prostate problems, particularly since these interventions possess proven benefits to overall and cardiovascular health. And how about before you're a prostate patient? Lifestyle habits associated with a decreased risk of developing clinical BPH are also highly likely to be beneficial in reducing the risk of erectile dysfunction, cardiovascular disease, diabetes. For this reason, urologists should encourage all men to undertake a prostate-healthy lifestyle.
I've had the experience of treating men with prostate cancer for over 20 years, and I've seen a huge evolution in how we do this. Proton therapy is really one of the most advanced, sophisticated ways of treating patients with radiation. It takes a very energetic particle, focuses it right into a cancer cell, and destroys it without treating the normal tissue. And I found that the patients who go through this form of treatment have really significantly fewer side effects, and they also demonstrate fewer long-term issues that they have to deal with. Because there is between 60 and 80% less normal tissue that gets irradiated, men's urinary function is maintained to a very high level, if not the highest degree, and this is probably the best way to preserve their erectile function. When a man with prostate cancer comes to our facility, first we meet with them. We do a consultation, going over the full medical history, reviewing all their radiographic data, doing a physical exam, and then talking about all the different treatment options. If it's decided that we're going to proceed with proton beam, we bring them back for a simulation. That's a mapping out process, where we figure out exactly the best way to treat them with protons. So we have a vast team of physicists, dosimetrists, physicians, and therapists who all work at creating a plan that is best and unique for every individual patient. Oftentimes, patients fly through the 9 weeks of treatment, and they really experience very little except gratitude that they found the place. I'm honored and privileged to be able to offer what I think is the most sophisticated form of treatment for patients, and I think it's the best that we can possibly offer to patients.